Welcome to In Your Neighborhood. I'm your host, Chris O'Rourke, as we continue our series, Conversations on COVID-19. This coronavirus has affected so many aspects of our life, from personal to business. We're seeing the effects on the healthcare field. Students are home when they should be in the classroom. And sometimes two of those worlds collide, as we find with Bloomsburg University, which has one of the top nursing programs in the state. Joining me today is Kim Olszewski. Kim, what is your official title with Bloomsburg University's nursing program?
Hi, Chris. Thanks for having me. My title is actually Graduate Program Coordinator for the Department of Nursing, which oversees all the 5 graduate programs that we have. And I'm also the Briner Family Endowed Professorship of Nursing.
Okay, so you wear a lot of hats there.
I do.
So you're not only on the administrative end, but you're also teaching as well.
Absolutely. I oversee the 5 graduate programs, as I just mentioned, but actually it's a teaching role as well. So I do teach at the graduate level for the nurse practitioner students.
Okay, so what kind of courses are we talking about there?
Well, for nurse practitioner students, we have, and largely our program is online. However, we do have what you call a hybrid program. And what that means is our graduate program has their core courses, which is the foundational courses such as pharmacology, pathophysiology, role theory. All of those courses are online. And then we bring the students to campus one night a week, typically for their clinical courses. Depending on which program they're in, it could be up to 4 courses. So I teach either at one of the foundational levels. This semester I'm actually teaching one of the clinical courses, the final clinical course, as a matter of fact.
And Bloomsburg University is unique in that it not only has the undergraduate program, but it also has a graduate program as well. Explain that.
Yeah, absolutely. Our graduate program, we have about 120 students, and we have 5 programs. The 5 programs would be nursing anesthesia, which is in conjunction with Geisinger Medical Center. We have 2 nurse practitioner programs, both in primary care. One is for the adult gerontology population. The other is for the family nurse practitioner. We also have a public health nursing, which entails the school nurses and the public health nurses, which you can imagine is a big interest right now, given the pandemic that we're in. And then we have an MSN MBA program, which is the blend between the MSN degree and the Master's in Business Administration. So we have 5 programs, about 120 students. One thing that kind of Bloomsburg did in the last year, we expanded what we call on-campus time to the Dixon Center in Harrisburg. So instead of students having to travel from York and Harrisburg, where we have students, they could make a stop at the Dixon Center in Harrisburg, and we actually remoted them into Bloomsburg and have them join us virtually. And we're looking with the same type of partnership with Mansfield University and having a site there.
And then undergraduate, I'm sure you have hundreds of students.
Undergrad, we have about 490. We just had a big increase in this incoming freshman class of 60 more students. Understand we get between 1,000 and 1,500 applications for just 160 spots. So it's highly competitive to get into our program.
Okay, so let's go back about a month when all this stuff started to happen with the COVID-19. What was your reaction when things started to really snowball?
Actually, it hit about spring break, right before spring break for us. So there was talk before we went out on spring break that things might look a little different by the time we come back. That was probably early March. So we were getting prepared then already to think about what things might look like in the next week or two, should we have to switch to going completely online and working from home. So we started planning way back the end of February, early March on what our plans might be as a department. As you can imagine, each department is different at Bloomsburg, but for the graduate program, it meant thinking about clinical. For undergrad, it meant, would students have access to computers? Would they have access to Wi-Fi? What would their clinical look like? So each facet of our program, we had to do some pretty serious planning on how that would look.
And it all took place in what, a week?
Give or take, give or take. Over spring break, we were told that we would be going completely online, that we wouldn't be coming back to campus. So, from a graduate perspective, as I mentioned, largely our program is online, but my peers that work at the undergrad level, really had some challenges because they had to quickly put their courses in an online format and learn how to be online educators, in addition to figuring out their clinical times and what that meant for their students. So it was a lot of planning, it was a lot of teamwork, it was a lot of blood, sweat, and tears, but we made it happen in a quick time frame.
Yeah, amazing too.
Yeah, absolutely.
You also had some new software that was able to help you as well, from what I understand.
Yes, absolutely. We quickly looked at what were other universities, what were other organizations recommending as far as what were you doing, I guess, in a sense, to, convert that clinical time to meaningful time for the student, that they would achieve the same outcomes. It's not exactly the same, obviously, as working in the classroom and working at the bedside. However, there was some software that we found that really does a nice job of simulating patient encounters. It was interactive, it was fun, and for the millennial learner, it was actually a really cool tool because they enjoy that type of learning, that simulation. So we purchased several programs to use for clinical substitution.
I think we also talked before this actually started recording about a fellowship program that you're also working with.
Yes, probably it's about 3-4 years ago. We were very fortunate to have a family, Ed and Julie Briner, who are actually alums of Bloomsburg University, and they left a significant endowment back to the university earmarked for nursing. One of their passions is actually to better their community and better the world, and they found that real connection with nursing. They have a daughter that's a nurse. So with that endowment, we were able to not only do a lot of unique things for our faculty and students, but we were able to make those purchases of that software for the student that, in a time where people are really hurting for finances, that it was not an additional financial burden. So we were very fortunate to Ed and Julie Briner for that gift.
Now, I know this might be hard to answer, but have you been able to, or have your educators been able to find teachable moments around what's going on as far as for the nurses? Are they able to tailor programs to deal with some of the issues that are coming to the forefront because of this coronavirus?
Absolutely. We've been receiving, all of our faculty get emails constantly from different vendors, different organizations, because we all work in different areas of nursing. And we share that as a faculty because we are using this as teachable moments on how to work in teams, how to be resourceful in a time where resources are limited. So we've been using case studies and different formats of learning modules to implement into our curriculum to show students, this is a pandemic situation. None of us have ever lived through it. How are we going to deal with it as providers? So yes, we're working as a team to implement that as much as we can into practice.
Is there also a little bit of guidance counseling going on, because some of these students are going to be graduating at the end of the semester and heading right into a hospital and potentially right into this situation?
Yeah, and absolutely. I think there's a fear of, what that might look like going into a pretty dramatic situation. One of the things that I've heard from my students, actually, I have 12 nurse practitioners getting ready to graduate, and one of their concerns is, how will they even schedule time to schedule their board exams, because all the testing centers are closed. So they're wondering, am I even going to be in a situation where I can test soon to become a nurse practitioner? So we are working with the accrediting bodies to find out, what they're doing to kind of maximize that, because it's a proctored exam. So they have some fear on how soon can I be licensed, more so than what it means to work in that setting, because a lot of my students are out there working right now, in the larger institutions and even the smaller institutions. We have some in corrections that are working, in the prison systems, and they're dealing with COVID right now. So their challenges are more what happens with my boards and how soon can I test. My undergrads, the feedback I hear from my faculty is certainly they're concerned. Who wouldn't be? I mean, it's trying times right now for sure. So we try and relay that and say, there's resources out there. You just need to, we teach you the right ways to do things. We just need you to be resourceful in how to do it.
Yeah, because the stories you were hearing out of New York City are pretty much akin to a war zone. How do you prepare someone to deal with a situation like that, especially someone so young?
It's hard because this particular group doesn't remember 9/11 and some of the, the flashbacks that I'm sure those New York providers are seeing now. And if you watch television, you're seeing, those interviews that say, excuse me, there's nurses that equate this scenario to what 9/11 was like or even worse. It's not a time to be fearful. I think it's just a time to use the tools we've given you, to practice safe, use your resources, and know that, we work as teams. We're not going to send you into a situation where we don't think you're prepared to be. And I think that helps. But there is a degree of fear. I'd be lying if I said there wasn't.
I'm sure there is. Although we know the nurses are the warriors of the healthcare field.
We'd like to think so.
Yeah, I know.
We'd like to think so.
What are you hearing from any of your nurses that are already out there dealing with this situation?
As I mentioned, my graduate students, like just for example, the class that I have right now, I have 12 students that are out practicing as registered nurses, but are moving on to that new role as a nurse practitioner. One works in corrections, one works, we have them working, at the larger institutions, the smaller institutions. And they're seeing it right now. But, certainly they are, thinking about what's my new role going to look like going forward. And, but they're practicing. I just spoke with one of my students today. She's in the Reading area. Hospitals down there are pretty well in capacity. They're seeing skilled nursing facilities full of COVID. They're seeing a lot of it down there, more so than what we're seeing here in central PA. So everybody's working in a little bit different atmosphere, but one thing is for sure, we talk and we share resources and give support to each other. So that's been very helpful.
So Kim, when you move offline like that as part of the program, the way you've had to adapt with COVID-19, what does that mean or do for the clinical side, the hands-on stuff you teach your nursing students?
Okay, well, our nursing anesthesia students, for example, again, that's in conjunction with Geisinger Medical Center. Their accrediting body says they have to have so many cases per learning experience, like how many deliveries, how many open hearts, and all that. So our students were well ahead of the curve there and had their cases, shall we say, completed to graduate. So their software is used to really just enhance what they've already learned, keep their skills fresh, and give them throw them scenarios in a virtual setting on how to mitigate. Our nurse practitioners, the minimum state board requirement for graduation is a minimum of 500 clinical hours. Our program has always felt strongly that more than 500 hours is needed to be not just successful, but to make sure that they're prepared for boards. So we well exceeded that 500 clinical hours, 720 for our adult gerontology, 920 for our family nurse practitioner. So we didn't feel the pinch a whole lot, other than we wanted to make sure we kept them current with the simulation tools.
And your students have always done well on their exams, haven't they?
Very proud to say 100% pass rate. Absolutely, we're very proud of them.
That's astonishing.
Thank you, thank you. We're very proud of that rate. Students come to us already knowing that statistic to get into the program because they're very confident in what our program is about.
That's why you're number 2 in Pennsylvania.
We're proud of that. Thank you.
Can you imagine what it's like dealing with a situation where you don't have the right PPE or all these terms that we're learning, PPEs or even masks to deal with this situation?
Yeah, I'm a practicing nurse practitioner as well. That's part of my, as an educator in advanced practice, we're required to practice at least 8 hours a week. My background's in occupational medicine. That's where I practice, and I've been doing that for 30 years. In occupational medicine, we're keeping the truck drivers on the road. We're keeping all those people that are essential workers working. We were faced with the same challenges in my discipline of not having enough masks. We've reached out to communities to help get masks that are homemade to hand out to the truckers and that at-risk population. But I can tell you it's a strain. Everybody's feeling the same issues of not having PPE. It's getting a little better from what I'm told in the hospitals, but it's still very much a real concern.
And you're also working from home, I see, in the meantime, educating from home. And I hope that continues to go smoothly for you.
I think by and large it has gone pretty smoothly. As I mentioned, we have been online for, a large amount of the time for the grad program. The undergrad program has switched to online. We will be online for the summer. We were told that already. So there's no face-to-face for summer courses. Fall, to be determined. I mean, it really depends on what happens if this tracks back around, or, if we can get over the hump and keep moving forward. So, but yes, we're home based now. Zoom is our new way of meeting. So it's a great tool. It's a great tool.
So we'll end this as I have ended all of them with, how are you dealing with this personally?
Personally, I have to say I'm, like everybody else, probably glued to the TV at night, wondering what's going on in the rest of the world, how this pandemic is spreading, listening to Dr. Fauci, listening to, all the stories that are being told by other healthcare professionals. That does motivate me because I see these people that are so passionate and are out there. I'd be lying if I said I wasn't a little scared going to practice when I have to, because I think we should all have that degree of being scared. But I think it's something as a nation, we've addressed it, we're moving forward. And I just had this conversation, actually, I was speaking with a physician earlier this morning, and we kind of had the same question for each other, like, where do you see things, on the other side of this pandemic? Where do you see healthcare going? And I'll make a plug right now for nurse practitioners and say that, there's a House bill out there, Senate Bill 25, House Bill 100, which is, pushing for full practice authority for nurse practitioners. And I think we've demonstrated as a medical community, we are on the front lines. We are serving a need. We're helping provide that care. The other thing I think that we're going to see on the other end of this is telemedicine, and how that's going to play a huge role going forward, because telemedicine has proven to be effective. So I do think hopefully things might change from a practice perspective. And again, I think we're just demonstrating how in the healthcare field we need to look at doing things maybe a little bit differently. And again, work in these interprofessional teams to improve patient outcomes. So I think there's a lot to be learned from this. I'm kind of excited to see how it might change for the positive, but a little scared to see how it's going to affect us going forward.
Well said. I think a lot of us are wondering what's on the other side of this as far as our lifestyles are concerned. Thank you very much, Kim Olszewski from Bloomsburg University's nursing program. Thanks for joining us.
Yeah, thanks, Chris. We appreciate you having us.
Okay, and we will be right back.